Hey guys, Dr. Trey Martin with Pursuit Physical Therapy, and today I want to tell you guys a little bit about back pain in a baseball swing, what could be causing it, and some potential solutions for this. So, some of you guys might be thinking, wow, I'm a baseball guy, I've never heard about people getting back pain during their baseball swing. But it's becoming more and more common as we see guys playing year-round and swinging a lot more than they used to. So, what is the cause of this? So, a lot of times what we see with younger athletes who are not skeletally mature and who don't have a lot of baseline of strength, as they swing, there's a lot of strain on the lumbar vertebrae and the bones of the region. So, what can happen is we have a phenomenon called a stress reaction that can happen in the low back. So this stress reaction happens and you start experiencing back pain. Normally it's going to be, if you're a right-handed hitter, it's going to be on the left side of your lower back, and you'll feel it during your swing. So one of the things that this can lead to is a condition known as spondylolysis and then eventually spondylolisthesis. This is a fairly new concept for most baseball people, but we see it a lot in the gymnastics community. So what happens first is we have a stress reaction and we keep putting stress to the area, we keep swinging, we keep adding load, and the structure in the lumbar spine known as the pars interarticularis, which forms a little tiny bone between each vertebrae, it can actually develop a fracture, and this can cause dramatic and even traumatic instability in the area that can eventually lead to your vertebrae actually shifting forward into a full spondylolisthesis, which can be very serious. So before we get to that later stages of things, I just want to go and highlight kind of what could be going on with this stress reaction phase of things and just some ways to calm it down. So if we think about the baseball swing, obviously we have a lot of rotation, so we're going to be rotating in and down, and that's going to cause a lot of force in the lumbar spine. So a couple quick tips that are going to be just crucial in lessening the stress on the lumbar spine is, one is really need to start improving our baseball strength and conditioning and working on things like low back strength, core strength in the form of and even rotational core strength in the areas of like obliques and muscles like that, and even our QL. So we need a really good comprehensive training program that's going to help correct some of these areas and build up a good baseline of strength, and this is going to help offload some of the force in the area. The second thing that we're going to really need to look into is a really good load management approach of things. So most of this is just an overuse, overload injury. So yes, you can maximize your strength and conditioning principles and be in a great place there, but a lot of times what we're seeing is guys are spending way too much time in the cage and they're hitting, all year round, day after day after day after day, and we really need to start looking into how many swings are we taking, and if you're having back pain, then maybe you take some time out of the cage and allow the bone to heal, and this is only if you're having symptoms at this time, and you really ramp up things like your core training and loading appropriately in the gym. So this is something that we're seeing a lot more of in clinics, is we're seeing baseball guys with back pain from the rotation of the sport. So super interesting, but if you or someone you know has been experiencing low back pain with your swing, this could be part of the problem here, is you're having a stress reaction from the bones being overloaded, or even, I've seen this before with a couple of baseball guys, is you may even have progressed to a spondylolysis or spondylolisthesis stage. So from a conservative standpoint, we can handle that fairly well with physical therapy care, as far as like the spondylolysis stage and also just the stress reaction stage. But it'll be important too if you're having a unilateral left-sided back pain with rotation and extension, to get that properly evaluated, either by first going there to a physical therapist who can probably help you identify some of your risk factors, or by going to get something like an x-ray done and a professional consult with an orthopedic doctor or even a general practitioner who can look into, okay, what's going on with the low back. And once that's cleared and the bony structures are cleared out, and level of damage is assessed, then we can start building out core strength and really work on stabilizing our low back and developing a great base of strength. And all in all, this is going to help if we have adequate range of motion, adequate strength. We're going to be able to handle a lot more reps in the cage. We're going to be able to hit more, and we're also going to be able to increase our power. So if this is something that's going on with you, drop a comment below in the comment box, and you can contact us and we can help give you the right resources that maybe can help address these issues. And if you're in the Orlando area, it'd be great. You can come stop by at any time. We'll get you in for an evaluation. We could look at some of these factors. So the purpose of this video, I want to keep it fairly short, but I just want to highlight that low back pain is becoming a very prevalent thing in the baseball community. And as a guy that was, huge baseball guy growing up and even in college, it's something that really hits home to me. So I really want to highlight this issue for you guys and let you know that it's becoming a common complaint. Hitters that are spending a lot of time, in the cage, swinging a lot, normally young adolescent athletes, we see a really high incident rate of spondylolysis or spondylolisthesis type injuries that are occurring in baseball guys. So this is just a little bit of a brief breakdown on it. Like I said, if you're experiencing this kind of back pain, you need to seek out a medical care in the form of either an orthopedic doctor or a physical therapist in your area. So if you have any questions or need any help with that, drop them in the comment box. And until next time, thank you for tuning in.